Dear friends, welcome to Know Thyself YouTube Channel. Good morning. Hope you're all staying safe and keeping well. I sincerely thank all of you who have subscribed to this channel and follow the channel. If you find the contents of the videos uploaded in this channel useful, please subscribe to this channel and click the notification or the bell icon so that you can be notified when a video is uploaded. Kindly share the videos with others or on the internet. In the last episode of Know Your Mind segment, we spoke about the nature, characteristics, and causes of resonance disorder. In this episode, we analyze the types and symptoms of resonance disorder. There are 4 types of resonance disorders: hypernasality, hyponasality or denasality, Cul-de-sac resonance, and mixed resonance. Let us briefly consider the nature and symptoms of each of these types of resonance disorders. First, hypernasality. Hypernasality involves the presence of abnormal sound energy in the nasal cavity during production of voiced or oral sounds. It is primarily a vowel phenomenon but can also happen with other voiced sounds. It occurs when the movable and soft part of the palate called velum does not completely close off the nose from the back of the throat during speech. As a result, too much of sound resonates or vibrates through the nose or nasal cavity while talking. This type of resonance makes the patient sound as if he or she is speaking through the nose. The voice is high-pitched, muffled, and is hard to understand. When hypernasality is severe, other abnormal speech qualities can occur. For example, nasal air emission, that is, air escaping through the nose, can be heard during production of certain consonant sounds such as P, T, K, S, sh, and ch. When nasal air emission occurs, the consonant become weak or omitted. In addition, the patient may use abnormal speech sounds such as hard oo instead of the consonant sound g because of the lack of air pressure in the mouth. This is usually due to some dysfunction of organs of speech such as a cleft palate, a submucous cleft palate, a short palate, or poor movement of the soft palate. In some cases, hypernasality can also occur after a surgery of the tonsils due to removal of too much tissue during surgery. Likewise, neurological problems can cause poor movement in organs of speech, resulting in hypernasality. Second, hyponasality or denasality. Hyponasality involves a reduced nasal resonance or energy associated with nasal sounds. This happens when not enough sound comes through the nose during speech that makes the patient stopped up. Thus, when you have a reduction in the quality of voice vibrations from the nose, there is not enough sound resonating in the nasal cavity during speech. You are said to have hyponasality. Thus, hyponasality is perceived when there is reduced nasal resonance on vowels and nasal consonants. In severe cases, hyponasality can co-occur with denasalization of nasal consonants such as m, n, and ing, making them sound more oral in quality, using B for M, D for N, and G for ing. It can happen due to blockage or congestion in the throat or nose. The cause of this blockage can be enlarged adenoids or tonsils, an obstruction in the nose, allergies, or a neurological condition. Third, cul-de-sac resonance. Cul-de-sac resonance involves sound resonating in the mouth, throat, or nose, getting trapped in oral, throat, or nasal cavities of the vocal tract, but is blocked at the exit of the cavities, typically due to an obstruction or blockage, and circulating within them without having any outlet to exit. As a result, the volume of the speech is reduced and it may sound muffled, indistinct, and quiet, leading to tinny or metallic resonance and indistinct speech. It may sound as if the person is mumbling and not speaking up. One can hear the air coming out of the nose during speech. The cause of cul-de-sac resonance is an obstruction or blockage in the vocal tract, that is, on the oral, throat, or nasal cavities. We can speak of different types of cul-de-sac resonance depending on the area of blockage or the location of obstruction, whether the blockage or obstruction is the oral, throat, or nasal cavities. Let us give a few examples. An example of oral blockage or obstruction is microstomia, small mouth opening. An example of throat obstruction or blockage would be enlarged tonsils or adenoids. And an example of nasal blockage would be nasal polyps or deviated septum, which is an obstruction of the anterior part of the nose. Similarly, cul-de-sac resonance may lead to significant hearing loss or inability to provide auditory feedback due to atypical tongue during speech. Fourth, mixed resonance. Mixed resonance consists in the presence or co-occurrence of hypernasality, hyponasality, and cul-de-sac resonance in the same speaker depending on the indented speech sound. For instance, hypernasality and hyponasality can occur in different times during a connected speech, as it occurs in apraxia, which is a rare speech disorder that makes it difficult for children with this disorder to control their lips, jaws, and tongue while speaking. Similarly, hypernasality and hyponasality may co-occur when there occurs a throat dysfunction and a nasal dysfunction. For instance, the improper closing of the soft palate muscle and the blockage in the nasal airway. Persons affected by one or more of these four types of resonance disorders would experience significant difficulties in interacting and communicating with others. Hence, the need to diagnose and treat persons suffering from these types of resonance disorders. In the next episode, we will elaborate on the diagnosis and treatment of resonance disorders. Thank you for watching this video. Stay blessed until we see you again with another video.